The National Department of Health has dismissed what it says are fake social media reports about a new COVID-19 variant. The department says the reports are misleading and causing unnecessary panic, especially since the influenza season is upon us. For more on this, I'm joined by South African Medical Association Chairperson, Dr. Mzukwa. Dr. Mzukwa, good to speak to you this evening. Now, some clarification on the Omicron XBB variant. What is your response to the recent dismissal by the Department of Health regarding claims of a new COVID-19 variant?
Good morning, good evening to you, Hugo, and your viewers, and thanks for having me in your program. We agree with the Department of Health that really these are fake news. You will recall that in this country, we've got a very sophisticated scientific infrastructure. What is known as the network for the genomics surveillance in South Africa, which is composed of the NICD, the universities like University of KwaZulu-Natal, UCT, University of Pretoria, Stellenbosch University, VETS, and all these other, and the National Health Laboratory Services as well. So this network has released a report. It was around the 5th, if I'm not mistaken, 5th of April, where actually the numbers are extremely low. We must agree that COVID-19 is still around, but in an endemic form. In other words, it's circulating in very low numbers. So it is really fake news that we must now say that there's a raise in the numbers and in a spark in the numbers of COVID-19.
So let's come back to the fact that COVID-19 is still around in very small numbers, but how does it manifest? Because I often speak to people that suspect that they have COVID-19, and some of them argue that, well, I seem to have those symptoms that they talked about a year or two ago when COVID-19 was at its height, or that there is a flu of sorts that seems to be going around at the moment.
Well, it is true that the symptoms, you must remember that COVID-19 is a respiratory symptom, a respiratory virus. Now, it does not differ from other respiratory the presentation of symptoms is almost the same. Where you find that you have you might have a sore throat, you might have fever, you might have a mild cough, also have headaches, and at times you might have loss of smell and stuff like that. But I must say that the symptoms, based on symptoms alone, you cannot tell. That is why if you diagnose a person with COVID-19, you do not rely on symptoms. You take a specimen or a swab and send that swab to a laboratory, for the laboratory to be the one that says you have COVID-19 or you have this virus that is troubling you. So based on symptoms alone, you can't tell if you're having COVID-19 or any other respiratory virus.
Now, what steps is the South African Medical Association taking to counteract the spread of false information? Because it must cause a huge amount of panic, particularly to those that are vulnerable.
Well, I must say, as an association, we strongly condemn this, the spread of such misinformation, because what it says that really it causes some unnecessary confusion, unnecessary panics, and also give, unnecessary or even misinformed advices, to say we must start doing this and doing that to avoid the virus. But in fact, what you are suggesting is what the Department of Health is emphasizing as well, to say, we know that there are vulnerable groups in the population. Like, for example, your elderly, those that are living with underlying medical conditions, they're very young, and we're saying to those people, there is a vaccine, for flu, because there's a flu season as well. People need to go out there and get a flu jab. If you've got diabetes, you've got kidney failure, you've got heart failure, and all these other conditions, you need to go out there and get a jab, a flu jab, so that you prevent yourself from getting severe symptoms of flu. at least you avoid hospitalizations and stuff like that. So we are saying we must never be tempted to to call any symptoms that we have, label it as COVID-19 simply because we exhibit symptoms that are similar to those of COVID-19. Let us allow our healthcare practitioners to assist us in terms of making a diagnosis.
Dr. Mzukwa, I want to rewind a little bit to the days of COVID-19 and the many conversations that were had. And one of those conversations was about achieving herd immunity. Did we ever achieve herd immunity? And the reason I ask is because there are hundreds of thousands of people that never actually took the vaccine, neither did they get COVID.
We believe that we have achieved herd immunity because herd immunity is not only based on the injections or the vaccines that were given, it's also based on natural immunity. Because if you get a virus, you develop that immunity. So it's not only achieved by taking an injection. So we believe that because of most of us got COVID-19. So we've got that immunity, that we got from the natural infection. But there are those that got it, got injections like myself. I got both injections and vaccination, and I also got COVID-19, the disease itself. So, we're talking about such kind of exposure that would lead us to, herd immunity. So we believe that we have reached that point.
Now, it raises the question of how difficult is it going to be to convince most people to take any form of vaccine. God forbid, should another virus of the nature of COVID-19 hit us again, if they didn't have to be vaccinated and live to tell the tale.
Well, I must say that conditions change as people grow. They change their bodies. Bodily function changes. So we do need really to consider taking vaccines if we are presented with that opportunity. But I must say that we must also differentiate between vaccines as it relates to the children's vaccination and also those vaccinations that come ad hoc. We must never confuse vaccination for children. Children must continue with their natural, with their normal schedules, as we know. I mean, we grew up injections as children because we needed to avoid measles, we needed to avoid all sorts of things. So we must never confuse the normal vaccination of children. We must, South Africans, vaccinate our children. If we've got issues then with the COVID-19, I think it's a separate issue, which we must never confuse with other vaccinations.
And lastly, given the peak in respiratory syncytial virus, RSV cases, and the upcoming flu season, what is your advice to individuals, particularly those that are a little bit vulnerable, as you've indicated earlier on?
Well, we plead with those that are in that vulnerable group. And we're talking about people with underlying medical conditions. We're talking about the elderly. We're talking about, people who might be having kidney failure, heart failure, and all these things, diabetes. We're saying to them, if this is a flu season, you need to go out there, get a vaccine, a flu vaccine. It's available with the doctors. It's also available with the pharmacists as well. So people must just go out and get that injection so that they protect themselves, from a severe form of illness that may even lead to pneumonia and may lead to hospitalization. God forbid, it may lead to death as well. So we plead with communities to really go out there and make sure that they protect themselves. But also, the other advice is that we must continue washing our hands. We must continue wearing masks, especially when we have a flu symptom. You don't have to have COVID-19 for you to wear a mask. Mask must be worn by everyone who's having flu symptoms, so that you protect your fellow workers, you protect your family members, your people in the community, even in churches as well. If you have got those flu symptoms, please just observe those basic measures.
Dr. Mzukwa, appreciate your time. Thanks again for speaking to us. He's the South African Medical Association chairperson and rubbishing those claims that there is indeed a new Omicron XBB variant.